So Cylera solves the problem of healthcare IoT and medical device cybersecurity. We started in 2017. We are a next generation AI-backed player in the healthcare cybersecurity space. The security risks faced by healthcare are many and wide. Obviously, cybersecurity is a massive concern across healthcare. We have a growing threat surface across healthcare as more and more technology, IT and IoT devices are added to our networks, as digital interoperability expands, as the portalization of healthcare expands, and as we add more and more medical and other IoT devices to our healthcare networks. That includes traditional medical devices, X-ray, CT, PET scanner, ultrasounds. It includes a lot of network connected devices that formerly weren't, like infusion pumps. It includes a massive number of medical wearable devices, which are now being integrated into our healthcare system. And only the last couple of weeks, Australia has integrated medical wearables via applications into My Health Record, the national health record for all Australians. So this is an expanding threat surface and an expanding cybersecurity problem. Cybersecurity is important in healthcare, just like it is for any other critical infrastructure industry. And healthcare is one of 16 industries designated as a critical infrastructure industry under Presidential Policy Directive 21 by President Obama. It is obviously a critical function for economy and for society. And unfortunately, it is also a prime target for cyber attacks. And we've seen this going back over 2 decades with the theft of personal health information, personally identifiable information, intellectual property, clinical trial information, drug formulations from the healthcare life sciences industry. More recently, we've seen attacks from the cyber espionage side of the house in terms of ransomware campaigns. Now, when healthcare is attacked, it means that health services are no longer available to the general public. So if you are suffering a stroke or a heart attack and you need emergency medical treatment, that treatment may not be available to you if a hospital is under cyber attack at the time. So there is naturally a patient safety concern that accompanies any attack against a healthcare provider. Cylera sits on a healthcare provider network, and it passively analyzes metadata traffic flowing across the network to identify indicators of medical device traffic. And it does a full protocol analysis in order to do that. So it will look for typical protocols that are used across healthcare. DICOM, for example, which is a common imaging format for medical imaging, X-ray, CT scans, ultrasounds, etc. And it will look for that traffic pattern coming from, origination IP to destination IP. It will look at the protocols used, it will look at the ports used, and it will build a profile of that communication traffic. It will then passively analyze the origination and destination endpoints of a device on the network, and will build a detailed profile of the devices in such a way that we have detailed asset knowledge of those devices, medical devices, that connect to the network. From that, we can perform a risk analysis in line with HIPAA risk analysis requirements to ascertain the true risks of a network asset and what risks that may pose to the integrity of the health system or to the safety of patients. Cylera is a zero resource impact tool. That means that you can implement Cylera in your healthcare environment without adding additional resources. And over the course of several hours, days, or weeks, depending on the level of activity of those devices, a profile will be built for each medical device attaching to the network. Now, the nice thing about Cylera compared to other competitors are that we don't just provide a list of assets and a list of associated CVEs or risks with each of those assets. But what we do is to seamlessly orchestrate the remediation of those risks, either through workflows that facilitate patching where patches are available, or through compensating security controls like microsegmentation using existing network access control technology that's already owned by the healthcare provider. Medical devices are growing globally at 18% CAGR. This is obviously a growing concern to healthcare entities. They now make up approximately 75% of all connected endpoints in a hospital environment. These are not typically managed by IT. So IT and cybersecurity typically have very limited visibility into the makeup of healthcare IoT devices attached to the network. That could be a traditional medical device system, or it could be something that is critical to hospital workflows that is also IoT. Things like HVAC, for example, which controls the flow of air to maintain clean rooms for operating theaters, or dirty rooms in the case of patients with infectious diseases. We obviously want to contain the airflow in those rooms so as not to spread to other patients or to nursing and other clinical staff. Also, things like elevators and escalators in hospitals, right? We can't transfer a patient from the ER to the OR to radiology to post-op recovery without the use of lifts and elevators. And those systems are typically controlled via a simple PLC from an organization that manages that for the hospital or the clinic from often hundreds of miles away. These are all connected to the internet, and they all pose a subtle risk to the integrity of the healthcare network. So our role is really to ascertain risks, to remediate those risks, and to solve problems for healthcare providers. So let me give you an example of how Cylera has helped some of our customers. One of our customers in particular was facing the prospect of spending $100 million on a new imaging center to expand their existing ER imaging capacity. They had reached full capacity, particularly on a Friday and Saturday night, with road traffic accidents and other emergency patients coming in for service or coming in for treatment, and were about to spend a large amount of money. Through the Cylera program that was implemented in their across their hospital, we were able to identify underutilized resources in other parts of the hospital, in particular an outpatient clinic. And by changing the workflows and sending the walking wounded across the parking lot, we were able to divert patients from the ER imaging center to an imaging center that was not normally used after 6 p.m. at night. By adding staff to that center, we were able to, with our customer, able to reduce lines at the ER and get emergency patients imaging that they required urgently. It's probably saved them 5 or 10 years in terms of the CapEx outlay for building that center. There are a lot of trends in healthcare that are concerning to cybersecurity professionals like myself. Obviously, the expansion of the threat service brought about by the growth of medical devices and other health IT systems that are now implemented at our hospital systems. We have a growth of medical wearables. Many of us now walk around with a Fitbit or an Apple Watch or something similar that records or acts as a sensor in order to record our level of physical activity or inactivity in the case of some people. It also combines with a medical app on our smartphone where we can enter our calorific intake and various other forms of information. That information can now be shared with our clinical care team, our dietitians, our cardiologists and others who would find that information highly useful in the diagnosis and treatment of our various medical conditions. But all of these devices expand the threat surface. They make it easier for a perpetrator in order to get to our non-public data, our PII, PHI data in our hospital systems, also to the intellectual property and commercial trade secrets that a lot of innovative health systems may have on their networks. And these are all prime targets for criminal perpetrators. There are a lot of issues when it comes to healthcare cybersecurity. Probably the single biggest bang for the buck, if I were to put my security leader hat on, is a question of security education, training and awareness. We have a large staff in our hospital systems, and they are the weakest link. They are the ones who will, under stress, perhaps click on a link despite training. They may open up an attachment, not realizing that it's from a fake address. So whatever we can do in order to minimize that initial threat vector into our health systems is a benefit. Most of the surveys out there, and we could quote Deloitte or KnowBe4, quote about a 91%, 92% statistic in terms of the initial vector for a cyber attack, which starts with a phishing email. So whatever we can do in order to minimize the impact of phishing via sandboxing of attachments, sandboxing of URLs, this sort of thing is going to be highly beneficial. But at the same time, we also need to put in place the right technologies to automate cybersecurity, given the fact that we cannot hire and retain sufficient cybersecurity staff in order to compensate for the types of attack vectors and the strength of those advanced persistent threats that we're seeing against healthcare. We need automated, intelligent tools that do this for us.